Is Accutane a slam dunk treatment for acne? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We are an acne treatment facility that only treats acne. That's all we do. And we like to share some of our experiences so that others who are navigating the path toward clear skin might benefit from some of the information that we provide. But remember, this is just for educational value. This is not medical advice. So is Accutane a slam dunk? Is it a no-brainer? Is it something that is always going to work and give you completely clear skin and it's just the right thing to do no matter what? So that's something that requires some discussion because Accutane is a great medicine and it does provide clear skin in most people who take it. However, it's something to take seriously. It's not something to just decide that that's what I'm going to do and it's just going to solve all my problems, because Accutane is a medicine that requires a lot of thought and a lot of experience to know how to treat a patient with Accutane and how to deal with some of the pitfalls that occur during treatment, as could occur with any medicine, but especially with Accutane. There are always some reactions to treatment that may be different from what we've seen in the past. And this is normal. Like I said, this is normal for any medicine because it's just a matter of time before a given patient reacts in a way that's unique to that patient. And it's not something that's typical of patients who take the medicine. So the same is true for Accutane. And Accutane has all kinds of different responses that require managing them in the right way to achieve the optimal result for that given patient. So there are different things that we need to take into consideration. We might need to change the regimen a little bit here, or tweak the regimen a little bit there, or alter the dose a little bit, or making other adjustments to the treatment that just make that treatment just right for that given patient. Now, the majority of patients, they react the same. They react similarly. And we give the medicine in the same way and they do fine and they have a good outcome, and then we conclude the treatment and everything goes great. But there's still that significant amount of patients, that significant number that do have those needs to make a little bit of adjustment here or there until you get just the right sweet spot, just the right regimen so that they have the best outcome without anything that's kind of a bump in the road, anything that we try to eliminate those things that might impede our progress. So the point is that Accutane is a great medicine. It is something that can be useful for many of our patients, but it's not something to be taken lightly. It's not something to say, yeah, just let me have Accutane. No, Accutane needs some discussion with your provider. Accutane needs a full medical history and deciding on what potential pitfalls there might be for a given patient based on their medical history, or based on their activities, or based on their environment, or based on a lot of things that might be unique to their life or their lifestyles that might not be the same for another patient. So all of these things come into play, and it's not unusual to do some modifications or tweaking how the Accutane is administered or used in that course of treatment. And all of these things are very important to consider when making that step and deciding that Accutane is the right medicine for you.